I am presenting a study on the surgical outcome of complex eyelid tear at tertiary care center. The author has no financial interest to disclose. The purpose of a study is to evaluate the functional and aesthetic outcome of reconstruction in cases of complex eyelid tear. Material and method. It is a prospective type study, included 54 patients with complex ocular and periocular trauma following road traffic accident. For the purpose of this study, the presence of eyebrow laceration, canthal involvement, pharyngeal tear, canalicular laceration and orbital fractures include along with the upper, lower or both eyelid tear constituted complex tear. The patients were classified into 3 groups based on site, size of defect and surgical procedure and outcome. Group A includes the central or paracentral eyelid defects with tissue loss of less than 1/3 of eyelid length with or without canthal avulsion. Group B, the tissue loss between 1/3 to 2/3 of eyelid length. Group C, tissue loss more than 2/3 of eyelid length. These are the representative pictures of group A, B and C. After detailed clinical examination and basic hematoradiological investigations, patients were planned for eyelid reconstruction. The wounds were copiously irrigated and explored with removal of any foreign material after local anesthesia. Reconstruction was done in layers as per correct anatomical orientation. Wounds were extended, explored in some cases where suspicion of foreign bodies. Result. Out of 54 study patients, an equal number, 18, were divided into group A, B and C respectively. In group A, patients underwent direct closure of the wound. In group B, patient needed mobilization of the nearby tissues for eyelid reconstruction. Group C, patient needed lateral advancement flap for reconstruction of anterior lamella and post-auricular cartilaginous grafts for posterior lamella. The post-op follow-ups were done on day 2, day 7, at the 2 weeks and 4 weeks and at the end of 3 months. On follow-up, patients were assessed on overall satisfaction using the Likert scale, closure of palpebral fissure, presence of ectropion and entropion. So this bar diagram shows the overall patient satisfaction. In group A was 4.78, while in group B and C it was 4.44 and 4 on post-op day 14. So this shows that group A patients were more satisfied compared to group B and C. The palpebral opening in group A patients, the mean value of lag of ophthalmos was 0.81 mm, while in group B and C it was 1.17 and 2.11 respectively at 2 weeks follow. The post-op lag of ophthalmos was minimal in group A compared to B and C. This table shows overall frequency and percentage of post-op variables among all 54 patients at different subsequent follow-ups. This table shows analysis of variance of patients lying in the group A, B and C with post-op variables outcome on the post-op day 1 to subsequent post-op shows there is significant difference in the lag of ophthalmos on post-op follow-ups. In group A, 40% patients had associated canthal laceration along with tear and 28% has canalicular tear, 20% patients had associated brow laceration, 30% patients had 1 mm lag of ophthalmos on day 2 and which resolved on day 7. In group B, 70% patient associated canthal tears, 30% had pharyngeal extension of eyelid tear, 15% associated with the orbital wall fractures, 38% had 2 mm lag of ophthalmos on day 2 which resolved at the end of 3 months, 20% had grade 1 ectropion on day 2 which resolves at 4 weeks. In group C, 40% patients 3 mm lag of ophthalmos on day 2 which resolved at the 3 months, 30% grade 1 ectropion on day 2 which resolved at 4 weeks, 10% had persistent grade 2 ectropion that needed ectropion correction surgery after maturation of scar. Conclusion. The repairing of eyelid injury is an art that requires good anatomical knowledge and meticulous approach. Gentle tissue handling and proper alignment should be done. Early intervention using appropriate methods will achieve the best functional and cosmetic outcome. Always bear in mind that primary repair is best repair. Thank you.